is Dr. Barbara Polivka. I am the Associate Dean for Research at the University of Kansas School of Nursing. I'm here to talk about Module 6, the Personal and Area Exposure Measurement module. The focus of this module is assessing methods for determining personal and area environmental exposures for clinical research. The objectives for this module, there's 3 formal objectives, and the first one is to assess and compare and contrast subjective self-report environmental exposure measures and common data elements. And the second deals more with the objective assessment of environmental exposures and objective area measures. And the third is really to evaluate these measures in terms of cost, convenience, time, privacy, exposure, misclassification, how desirable they are, recall in terms, especially in terms of self-report, response rates, scoring, and missing data. So those are the 3 objectives that are the primary focus of this module. So the first objective, as I said, deals with self-report. So we look at a lot of different instruments, some that are in the literature, some that are available online without cost. One of them that is in the literature was developed by Dr. Beth Shank and her team, and it is called the Nurses Environmental Awareness Tool. And this tool measures nurses' awareness of the negative environmental impacts, primarily of their practice. It is a tool with 48 items and 3 scales. The Nurses Awareness Scale assesses awareness of the environmental impacts of nursing practice and how they relate to health and risks to health. The second scales focus on nurses' workplace behaviors to actually mitigate environmental impact. And the third scales focus on nurses' behaviors outside of the workplace to mitigate environmental impact. So that's one of the tools that we discussed that's in the literature and is accessible that way. We also spend some time talking about the FENIX Toolkit. This is available online. These are a number of instruments related to a number of different health-related measures. And these measures, all the tools in the FENIX Toolkit have been vetted. They are available free. They are valid, reliable ways to measure different areas. And so one of the things that we look at is within research domain entitled environmental exposure. And you can see here all of the other domains within the FENIX Toolkit, but we primarily focus on the environmental exposure domain. But you can also look at respiratory, for example, if you're interested in asthma, as I am, cancer, if that's your area, maternal child, if that's your area. So there's a lot of different areas in here that you can look at. Another place to get instruments is the REDCap shared library. If you have access to REDCap, which is available in these days most universities, there are a number of tools that are available that are downloadable that you can use. One that we've used is the Dyspnea Airborne Exposure Tool, and that is a promise measure. The idea of promise is that they can be used across multiple areas and you can compare findings using these measures. But as you can see here, there's also a measure called Environmental Exposure Questionnaire, and you can find others, but here I searched on the topic of airborne exposure, so this is what came up when I searched on that. So here is the Dyspnea Airborne Exposure Tool. This is a promise tool, and it assesses things like things in your home that trigger breathing problems, if you were exposed to pesticides or cleaning products, exposed to smoke, do you live in an environment with extreme changes in temperature? So these are questions that are downloadable and available to use as survey. So we focus a lot in this module on indoor air quality, especially residential. That's an area that I focus my research on. And there are a lot of exposures indoor. Many times our indoor air is much worse than our outdoor air, but obviously the outdoor air impacts indoor air, especially during specific times of the year when windows are likely to be more open. And you can see here from the multiple areas that you can have exposures in the home office. There can be exposures from printers in the living room, fireplace, garage, carbon monoxide and gas, and the list goes on and on. I spent some time in this module talking about some of the studies that I've completed in which we have been investigating air quality. One of the studies that we completed was on asthma in older adults, and in this study we assessed volatile organic compound exposures, both residential and outdoor, and we were looking at the impact on asthma and asthma phenotypes. So in this study, we collected both self-report and objective measures of environmental exposures. We collected self-report data both at baseline and 18 months. We would ask our participants about things like did they use a vacuum with a HEPA filter, how often they did various cleaning, dusting and cleaning in their home. Is there moisture in their home? Did they open their windows? Is the dryer vented outside? We asked about pets and the number and type, and if their pets are allowed in their sleeping room. Did they have pests, or did they spray for pests indoors? What was type of heating and cooling did they use? Did they have in their home? And how often were their furnace filters changed? Were there any odors detected? And this was something the person who was assessing would see if they detected any odors, and then we would ask the participants if they detected any odors and if they did any hobbies in their home. So in terms of the objective measures, we assessed volatile organic compounds, 84 different VOCs. We did this indoor and outdoor at baseline, and indoor only at 18 months. And you can see the canister and the instruments that we used to collect the VOCs. We also collected particulates, temp, humidity, and carbon dioxide at baseline at 18 months. And then at 18 months, we were also collecting some information on nitrogen dioxide and carbon monoxide. So this is a slide of the different instruments that we used outside of the VOCs. So we have temp and humidity, and the one on the right is the Delos air quality monitor that assesses particulates. One in the middle assesses temp and humidity. So these were placed in the room where the participants spent their most of the time, about a meter off the floor, and in an area that hopefully they would not, disturb over a 24-hour period, and they were there for 24 hours. So one of the issues with environmental data is, what do you do with all this data? So we talk quite a bit about this. The data that you can collect can be continuous, or it can be sporadic, and we collected continuous data for particulates, and we collected total amount of VOC exposure over a 24-hour period for the VOCs. But here you can see in the particulate data, like we have data that we collected every hour. So how do you manage that amount of data? What do? Do you look at 24-hour peaks, low, average? Do you graph it? What do you do when there's missing data? So we talk about that. What do you do when your equipment malfunctions, which happen more than we'd like to think? And sometimes things are inadvertently discontinued, knocked down. For some reason, if they're plugged in, the electricity goes off, or in some of our newer studies, we're collecting, having data immediately uploaded to a dashboard, and if the Wi-Fi goes down, then what do? You end up with, big chunks of missing data. So how do you manage all this data is something that we do talk about. Here's another example of how we manage some data, and looking at the analysis we were analyzing here, looking at differences in temp and humidity based on whether they were determined to have very poorly controlled, not well controlled, or well controlled asthma based on the asthma control test. That's the ACT. Again, this is, how do you connect the exposure to the health outcomes? That is really continues to be a major discussion topic, and one that we want to continue to work on. So we do, again, talk a lot about what are the strengths and limitations of various data collection methods. This is a list of the strengths and limitations of the asthma in older adults study. We collected data over a 24-hour period, so that's just one block of time in somebody's life. There can be exposures over a longer period of time. In other studies we've done, we've collected data over a 14-day period. So what's the length of time that you need? Is it just a snapshot, or is it over a period of time? And then can you validate self-report data with observations? How do you manage, again, longitudinal data? Do you collect indoor and outdoor data? And what do you do with, again, all that data? Do you collect specific type of volatile organic compounds, or just total VOCs, which both are done a lot in the literature? And then how do you give that information back to the participants so that it's useful for them? Some of the weaknesses and the limitations. We found that a lot of people would tend to clean their home before you're going to collect data in their home, even though we ask them not to. We talk about as I mentioned, what you do when there's equipment malfunctions, how many times and over how many times do you collect data, and do you go into the home, do you drop data off, do you mail it to, or the instruments off, do you mail it to them? How do you manage a lot of that? The cost of the equipment, the cost of the personnel to manage all this is extremely expensive. And how do you manage that? Do you use multiple sensors? Some use specific sensors, they're more sensitive to that, but then you've got more sensors to deal with. Or do you use just one sensor that collects multiple types of data? I mentioned calibration. How do you calibrate the instruments, and how often? Where do you place them? And do you place them in the room as we did, that people spend most time in? Do they really spend more of that time in, or are they getting more exposures in another room where they spend less time? It's always difficult. And then the privacy issues are certainly of concern. So here are some examples of some of the other types of air quality monitors that we talk about and have used. There is the Plume Flow, which is a personal air pollution sensor, the AirBeam. The Purple Air now has indoor and outdoor sensors. The outdoor sensors are being used a lot in communities to assess, for people to assess their outdoor air right outside of their home or living place or workplace. And one of the reasons for that is the EPA monitors are not always reflective of an individual or a family's exposures outside. So these allow for much more individualistic assessment of exposures. And then the indoor sensors. Now, Purple Air is just particulates. Then there is the wearable vapor monitor. This is something that's used a lot in occupational settings to assess occupational exposures, that people wear them near their breathing space. One that we used recently is the AirWare Indoor Air Quality Monitor. In this one, we are looking to assess exposures, indoor residential exposures in real time, and determine using a connection, an API connection between the Aware and people's smartphone using ecological momentary assessment to assess actual real-time symptoms when there is an exposure in the home. So we're very interested in real-time exposures and real-time symptoms in those with asthma. So these are some examples of some of the other monitors that we talk about. Something else we talk at length about is which sensor to use. What are the pros and cons of each sensor? How do these sensors work? What are the needs for your study? And what makes most sense in terms of the type of data you want to collect, cost issues, and so how do you make that determination? So we do look at that in some length. We've just added a module on recording on silicone wristbands, and this was recorded by Dr. Anne-Marie Walton. So silicone wristbands are being used, I think, a little bit more often these days, a lot in occupational exposures, but also in other personal exposures. They are able to determine personal exposures. They're inexpensive, passive, non-invasive. They assess cumulative exposures, and a mixture of toxicants can be analyzed and determined. And they capture both inhalation, dermal, and dermal excretion. So in this video, Dr. Walton goes through the pros and cons, how they work, what they're useful for, how they compare to other measures. So it gives you a good overview of silicone wristbands. So another area that we focus on is how to determine the usability and acceptability of these various monitors, ways to actually objectively collect environmental exposure data. So we talk about some standard tools that are out there, such as the system usability scale and the acceptability of intervention measure. And we also talk about looking at interviewing, focus groups, open-ended questions on surveys, so multiple ways that you can get at the usability and acceptability of these instruments. So that's an overview of this module. Some of the other things, resources that are available, there are resources related to collecting data on water environmental exposures, lead, soil. There's a lot of resources related to what the EPA has available, as well as other reliable sources that you can count on to give you good information about personal and area exposure measurement. Thank you very much.